Tobacco-Free Ireland programme with over 20 years' experience in public health and health promotion. Since 2008, Martina has led the tobacco control initiatives, including drafting Ireland's first 5-year strategic plan, standardising stop smoking services, and overseeing award-winning media campaigns. Martina's work is grounded in research and evaluation, with published studies and commissioned projects. Under Martina's leadership, funding has been significantly increased, tripling staff numbers and enabling free stop smoking medications nationwide. Martina holds a master's in health promotion, public health, and additional qualifications in healthcare management and education. And today, Martina will cover nicotine vaping and understanding the challenges. Thank you, Martina.
Thanks so much, Nikki. I'm delighted to have the opportunity to talk to everybody. So I'm going to talk a little bit about, why we're interested, I suppose, in vaping and the growth in vaping among youths from a tobacco control point of view. Obviously, my program is around stop smoking care, reducing smoking prevalence because of the huge harms of smoking to the population at a wider level, and the cost to healthcare, and the challenge, I suppose, that vaping and e-cigarette growth has had in terms of us addressing and trying to achieve a tobacco-free Ireland. So I'm going to be covering e-cigarettes as a cessation aid, whether they're useful in that or not, harms of e-cigarettes in and of themselves, how nicotine affects the body, and what we're doing now, and some of the resources and what we're doing next. Also covering a little bit on legislation, because that came up in the Q&A in terms of what parents and people are looking for in terms of what's happening in that space. So tobacco control in Ireland, we're well off track. Our target is to achieve a 5% goal of smoking prevalence by this year, and we're well off track in that. 100 deaths a week and 1,000 hospitalizations every single week. So that's the equivalent of St. Vincent's or Limerick University Hospital, filled entirely with people who were in there purely because of their smoking. So huge harm to health. And we're well off track in terms of smoking prevalence. It's stalled at 17-18% for the last number of years. And the challenge, I suppose, of e-cigarettes in terms of that is that, we've done studies and we know that e-cigarettes, initially, I suppose 10 years ago when e-cigarettes came on the market, people were using them as a cessation aid. But the study we've done very recently and published in Lancet shows that dual use is more common and quitting intentionality has reduced. So do e-cigarettes help in smoking cessation? We published clinical guidelines a number of years ago and looked at whether or not e-cigarettes had a role to play in smoking cessation, whether or not we could recommend them. And there were some studies that show that e-cigarettes do help some people in terms of smoking cessation, but they were no more effective than licensed stop smoking medication. And the HRB, Health Research Board, did a study in terms of the harms and benefits and found that e-cigarettes have harms in and of themselves. So when you have a licensed stop smoking medication like nicotine replacement that we know has decades of a safety profile versus e-cigarettes which have harms in and of themselves, then the recommendation was that we would stick with licensed stop smoking medication which we know have good record in terms of safety profile. And e-cigarettes in and of themselves cause nicotine dependence, which I'll talk a little bit more about later on, damage heart and lungs, exacerbate asthma and lung conditions. And while we can't say there's cause and effect just yet, because that will take decades to see, there are cancer-causing chemicals within e-cigarettes in and of themselves. So who's driving the e-cigarette industry and to what end? We know that tobacco industry have significant shares and own many of the e-cigarette companies. There's some, and there's some images, some of the products that are there. White snus is another new product that you may not be familiar with. It's not containing tobacco. It usually contains synthetic nicotine in really quite high doses with flavors to make it more attractive, designed to be put into the mouth and nicotine absorbed through the mucosal membrane, which is quite vascular and lots of blood supply there. So, absorbed very quickly. And the industry playbook, again, in terms of targeting of children through flavouring, through packaging, through advertising on social media and through influencers, lobbying government to try and disrupt legislation in this space. and challenging evidence-based research. So who's vaping, and you know, what's the prevalence? Why are we concerned? E-cigarette use increasing across the population generally. Adult use has moved from 3% to 8%, and in 1 year, in 2 years, sorry, from 2022 to 2024, in under 25s rose from 10 to 17%. Among 15 to 16-year-olds last year, the most recent study has shown a doubling in e-cigarette use from 1 in 10 to 1 in 5 at 20%. So really high use among young people. And, that's why we're really concerned. The other thing that the Health Research Board found is that children who start vaping young are 3 to 5 times more likely to go on to transition into regular smoking and normal tobacco smoking later in life. So that's obviously a significant concern. So nicotine in and of itself, why are we bothered about it? Why, does it do any harm? Is it a concern? Nicotine is harmful. It's inhaled into the lungs through a vape or through an e-cigarette, transferred rapidly into the bloodstream, reaches the brain in 7 seconds, and causes dopamine, feel-good hormone release. And it changes the chemical makeup of the brain, and nicotinic receptors are developed in the brain, which is, significant because it changes that chemistry for life, actually. And people who've given up smoking, or maybe who smoked years ago, and maybe 30 years later, you hear anecdotes of people who've gone back smoking. Because the brain remembers those nicotinic receptors are there, and that there's always a risk if you expose the brain again to nicotine that relapse can happen. So really, really kind of worrying from that point of view. Short-term effects of vaping for young people are for pouch use, nausea, vomiting, diarrhea, dizziness that can happen. And a term that kids use a lot is nic sick, so being sick from nicotine, when they first try it. Long-term effects of vaping in terms of mental health, we know that the part of the brain that is affected through nicotine use, attention, learning, mood, and impulse control are affected in terms of that. So also sleep as well is disturbed, and sleep is really important in terms of youth growth and growth, cell repair, and just growth more generally, and our mental health, of course. So nicotine addiction really impacts sleep, sometimes wakes people up in the middle of the night. And we've heard anecdotes of some people who are vaping, waking up in the middle of the night, having a vape under their pillow, needing a hit in the middle of the night to kind of try and get them back to sleep. So that's really challenging. Other long-term effects include risk, I suppose, of exacerbations of asthma, and obviously nicotine as well impacts our bloodstream. It increases the risk of blood clotting, and it increases blood pressure, and risk of heart disease long term. Vaping and synthetic cannabinoids, and my colleague Bobby Smith will be talking a little bit about that, but vaping, I suppose, facilitates easier access to other drugs through e-liquid, and makes it more attractive because the flavors are there, and it's more pleasant. And from the HRB study, we know that children who vape are 3 to 5 times more likely to go on and smoke later in life. Gum disease is also another emerging space, and we're examining the evidence in terms of that. The Irish Dental Association have contacted us and have seen changes in gum health from children who are presenting to various clinics. So what's the current legal position on e-cigarettes, and what's being done to protect? So it's now illegal to sell e-cigarettes or vapes to children under 18 since December 23. Nicotine pouches and snus, the other term, is still legal to sell, advertise, and promote and give out at sponsor, at events. In terms of that legislation for under 18s that came in December 23, it's also illegal to advertise or cause advertisement near a school within 200 meters of a school. However, if there was an e-cigarette shop within a school, they're allowed to advertise because they have that business. And just a few days ago, there was a ban on self-service sale of e-cigarettes and tobacco in vending machines. The future legal position, so there's lots of different pieces of legislation and measures coming in. On the 1st of November, a new e-liquid product tax of 50 cents per millilitre of e-liquid is coming in, and there may be more announcements in the budget later this afternoon. In February in 2026, next year, a new annual licensing system for retailers of e-cigarettes and tobacco products will come into effect. So we'll at least have a picture of all of the retailers that are selling e-cigarettes, and they will be required by law to register. And there's a couple of new bills as well coming in terms of a ban of sale on single-use and disposable vapes. There's also work to bring about this bill, which will restrict colours and imagery and packaging, ban devices resembling or functioning other products such as toys or games, restrict flavours, and ban point-of-sale display. So, e-cigarettes will not enjoy that pride of place in every store that they do at the moment. Hopefully, when those bills go through the stages of the Dáil and get passed, hopefully. So, how have we responded as a health service? And this has been hugely challenging. We have got funding this year, and we're in the middle of developing a media prevention campaign with two audiences in mind: young people themselves and parents and guardians. Our environmental health colleagues obviously have a role around inspecting manufacturers, distributors. They carry out test purchasing, so they do kind of secret shopping, for want of a better word, where they send in minors into stores to see if they get sold products, and then they prosecute based on the findings of those tests. And they're busy preparing a new IT system and the register for that piece of legislation that's coming in February of next year as well. We've been working with Spun Out, a youth website, TUSLA, Planet Youth, various drug task forces to try and produce resources. And we've also designed a new toolkit for youth workers focusing on prevention of vaping, and there's some new pouch lessons being drafted as well. So on this slide, there's just a couple of images of some of the resources. We have this new e-cigarette and other nicotine products resource, which you can order from healthpromotion.ie. We worked with our colleagues in the Department of Education and developed new health education curriculum, which addresses smoking, vaping, and other nicotine products. And we've lesson plans in first, second, and third year developed. And we have this Quit for Youth program as well, which is a 7-week stop smoking vaping program for young people. And you can find out more about that by contacting your local health promotion department. So, I mean, there are ongoing challenges. We know what works for stop smoking care, but the evidence is only emerging in terms of what works for stop vaping care. And there's some challenges with licensing of medication for stop vaping care. And responding to this issue is challenging in terms of having the evidence, and as it's a new product and it's emerging. We are also not resourced as a health service to develop or to deliver a stop vaping service. We're resourced to deliver stop smoking care, so we're hugely challenged in that, and we're very busy delivering stop smoking care. So that's another challenge for us. So where to next, and who has a role to play? Obviously, number of different government departments, not just ourselves in the HSE, but the Department of Education, Department of Health, our legislators and our elected representatives have a role to play in terms of strengthening legislation, and I've described a little bit of some of what's planned in that regard. You as parents and young people themselves have a role to play. Our retailers in terms of responsible sales, and the Department of Environment and Climate, who brought the initial proposal for the ban of disposable vapes from an environmental point of view to play. So finally, I'll close by just summarising in terms of what schools can do. One of the things we're planning on doing is writing out to schools very shortly as well, and they will communicate with all parents hopefully via the apps that schools use to communicate with parents. But schools can help by, covering those lesson plans, discussing vaping, nicotine pouch use, nicotine addiction, the risks of nicotine addiction within the classroom environment and within the curriculum, within SPHE, and looking at their own policies around how they manage this issue. And we have some guidance around that as well. And parents and guardians can help by talking to your child. This is a challenging area. I have teenagers myself, and it's a challenge in terms of how do we manage this, how do we keep the lines of communication open, and how do we help them navigate this space. We have some content on our website about talking to your child at different age groups, and then we also have content about how to know the signs of vape use and what to do if you think or your child is vaping. There's also new advice on our website there as well. So I'll close there and hand you back to Nikki, and we will look forward to the questions through the chat and later on in the webinar. Thank you very much.
Thank you so much, Martina, for that excellent presentation. And I know we've quite a lot of schools and teachers registered who will benefit from the information from schools there as well. So next on to Professor Bobby Smith, who will look more so at psychoactive substances. So Bobby is a consultant child and adolescent psychiatrist who acts as a clinical lead across 3 adolescent addiction services covering both Dublin and Wicklow regions. He's a clinical professor in Trinity College Dublin, and he has published over 90 scientific papers in the field of addiction. He's on the National Oversight Committee, which monitors the implementation of Ireland's National Drug Strategy. He is the chair of addiction in the Faculty of Psychiatrists in the College of Psychiatrists Ireland, and he's also vice chair of Alcohol Action Ireland. So today, Bobby's going to focus on vaping products and psychoactive substances and what you should know as a parent. Thank you, Bobby.
Okay, thanks, Nikki. Okay, hopefully this will all work smoothly. Thanks very much for the invitation to talk to everyone today. And it's great to see the level of interest actually that has been in this. As Nikki said at the outset, we've run 3 or 4 webinars before, and interest in this topic is bigger than we've had on previous occasions. So what I was going to touch on is a bit of an overview about some of the data we have from Ireland on who is vaping, a bit about the risks of the various vape products. Martina has obviously outlined the concerns around nicotine. I'll give you my spin on those, but I'll also talk about the other products that have emerged in the marketplace, piggybacking, I think, on the normalization of nicotine, looking at the addiction issues, the mental health concerns, and some of the physical health concerns. And then I'll finish up by just looking at some Irish data on what we know about the protective factors. Okay, so first of all, how many teenagers are vaping? How big of an issue is this? Well, this is data from a county in Ireland that participated in the Planet Youth Survey. Teenagers aged 15 and 16 interviewed at the autumn of last year. And close to half had used an e-cigarette or vape product at some point in their life. A quarter had reported use in the last month. Rates been slightly higher in girls than in boys, and 13%, which is about 1 in every 8 15, 16-year-olds said that they were vaping on a daily basis. So those figures are slightly higher than other survey data, but I have no reason to disbelieve them. In terms of where people are sourcing the vape products, the 2 primary locations are from their friends, which accounts for about a third of young people's primary source. And in spite of the legislation banning sale to under 18s, which arrived in late 2023, a third of these teenagers said their main source was actually from shops. Sorry, my slides are slow to move. Okay, so, and again, in the survey, people were asked, well, what is it that you are vaping or have vaped in the last year? So nicotine obviously leads the way with 2/3 of those who vaped saying that was what they were vaping. The next largest group of bars there are young people who reported using flavor-only vapes, which they thought had no nicotine in them. Now, we know from some of the analysis that's been conducted on products that are sold as zero nicotine that many of them do actually contain nicotine. So I would work on the assumption anyone who's vaping is getting some sort of an addictive chemical in whatever they're consuming, and that is generally nicotine. But on the right-hand side of the graph there, you'll see the proportions of teenagers who say they were vaping other products. So HHC is there on the right-hand side, and THC. So THC is the active drug in cannabis. HHC is a sort of a modified version of some of the chemicals in cannabis that basically, though, has the same effects as THC. And THC is the addictive drug in cannabis. It's the drug that causes the pleasurable effects, but also the drug that causes the mental health effects as well. Why were young people in this survey? Why do they say they were vaping? Well, it's, I suppose, the two big reasons that you see topping the list of any survey of almost any youngish age range as to why they've tried a substance are curiosity, experimentation, and they've heard about these things. They're actually been sort of, I suppose, increasingly marketed at on their social media. Every time they go to a shop, they're there behind the sweet counter. So young people just sort of give in and they decide to give it a go. Particularly if maybe some of their friends are doing it. And they're often just seeking a bit of a buzz or looking to see what sort of pleasurable effect it might have. On the right-hand side there, though, you'll see that some young people who've got maybe mental health issues, problems with low mood or anxiety, may try these products to assist with some of those symptoms. And then one of the more common reasons was, again, to feel part of a group or to feel more mature. And again, it was a classic game plan for the tobacco industry back in the 70s and 80s when they could advertise to present and market these products as though linked to maturity, adventure, and so on. And the people marketing the products, the vape products now, are using the same strategies on social media and so on. So why is it that we worry as parents about our teenagers heading down the path of vape use? Well, first of all, in terms of nicotine, nicotine vaping has really normalized the whole practice of vaping. Obviously, this was a behavior that just didn't really exist 10, 15 years ago. It's now really widespread. You see it everywhere. The clouds of smoke are vape or vapor. So it's normalized a new method of drug consumption for humans. And when nicotine is a extremely addictive drug. And even though I work in the Adolescent Addiction Service, it's not a drug that we generally got terribly involved with where people were smoking. Because I suppose the disabling nature of smoking addiction, actually wasn't massive for teenagers. The big issue with smoking is more the long-term damages it does to your lungs. But with vapes, we were hearing increasing stories of young people being extremely addicted to their vape and really struggling to get through a 1-hour class without sort of getting rattly and beginning to get irritable and anxious and stressed, and even then create excuses to leave the class early or race out of the class after the 60 minutes to go off to the toilet to have a few drags out of the vape. So the extent of nicotine addiction that we're seeing with vapes is many multiples of what we would have seen with smoking addiction. And that's down to the fact that it's so easy from a physical point of view to consume large quantities of nicotine very quickly and rapidly develop an addiction and tolerance. And withdrawal symptoms are unpleasant. So it's a nuisance, whether you're 15 or 50, to be addicted to anything, to be cycling in and out of withdrawals on an hour-by-hour basis. So as parents, we'd obviously rather our kids didn't have to negotiate that type of challenge. And as Martina alluded to, there is evidence now that a subset of young people who go down the path initially of nicotine vaping may then be inclined or more tempted to experiment with some of the other vape products, which were sold legally in our shops, as in the HHC type products, but there's also vape products now been sold in the black market. So nicotine, again, not a drug that used to concern me much as an adolescent addiction psychiatrist, but one that's definitely begun to concern me more. But the other vape products definitely do concern me and have concerned me. So HHC I've already mentioned. So it is this chemically modified version of one of the natural chemicals which exists in the cannabis plant. It became, I suppose, widely used and widely available really as a result of legalization in the United States, which resulted in overproduction of cannabinoid type products. So they're wondering what to do with these. So they began chemically fiddling with them, and they created this new drug, HHC, which seems to have effects pretty much identical to THC, the active drug in cannabis. So over the last couple of years, we began seeing more and more of young people attending our addiction services with problems related to HHC. Initially, that was often in the background, or maybe a secondary problem with a primary problem related to cannabis. But certainly in 2025, probably HHC had moved up to being the main drug for about 20 to 25% of young people accessing our services in Dublin and indeed nationally. So that's certainly number one concern with HHC. And the other concern, problems that were being seen by my colleagues in our more general mental health services, both with adolescents and with adults, in particular psychosis. So psychosis is where young people and adults indeed lose touch with reality. They maybe become paranoid, they get deluded in terms of maybe thinking that the water has been poisoned or their mother is actually now an imposter. They may hear voices and so on. And that's what we call a drug-induced psychosis. And HHC certainly has the capacity to cause drug-induced psychosis, as do THC and cannabis indeed itself. And I suppose what happened over the last couple of years is that HHC moved up from really being non-existent as a concern or as a driver of mental health problems maybe 3 or 4 years ago to become the second most common cause of drug-induced psychosis in our psychiatric hospitals in the last 12 months. And there's also some other mental health concerns that young people who use a lot of HHC would report, particularly impacts on mood flattening, becoming quite depressed, or maybe becoming stressed and anxious. There's also THC vape type products. Again, these were never sold in shops, but are sold on the black market. And these have all of the exact same problems as cannabis itself, which contains THC. There's also the reality that these products that are sold to young people, maybe as THC vapes, are actually, I think, by and large, they're synthetic cannabinoids. So these are man-made chemicals that act on the same receptor as the HHC or the THC in the brain, but have a much more potent and adverse effect. So again, that's what's causing presentations linked to addiction, linked to mental health problems. There's also some physical health issues related to THC type products, such as a vomiting syndrome called cannabinoid hyperemesis syndrome. And certainly in the United States, we haven't, I think, really seen it here in Ireland, that these products are made illicitly. There's odd additives put into them intermittently, and that has caused some really severe lung problems intermittently over the last few years in the United States, where these products are more widely produced and used and causing really severe lung damage for young people that's resulted in admissions to intensive care and so on. There's also just the known unknowns. You know, the truth is all of these vape products, whether nicotine or these other products, we've no experience of long-term use of these products. So we're really guessing as to what might be the consequences of a 10 or 20-year history of vape use. And I guess the worry is, doctors were instinctively pessimistic, or we don't like not knowing. The worry is that inhaling all these products with all these untested additives is not going to necessarily end well. I've already touched on this issue, just the research evidence pointing to the pace of onset of nicotine addiction that you get with the nicotine vape type products. And also with the nicotine pouches that I think Martina alluded to. like some of these pouches are unbelievably strong. I find it remarkable that you can get a pouch that seems to contain about 40 milligrams of nicotine, half of which will get absorbed into your bloodstream. It's about 20, so the pouch will deliver about 20 milligrams of nicotine. A single cigarette delivers about 1 milligram of nicotine. So a single pouch will deliver as much nicotine as 20 cigarettes. I just find it stunning. And these are completely unregulated. They can be, there's no rules prohibiting their sale to children. And it is young people who seem more prone to using them. They're not been marketed as anything to do with smoking cessation. They've been marketed for a buzz effect. And that is currently legal. So, you know, I suppose I come at this from a perspective of addiction and my concerns around that, and also as a psychiatrist about adverse mental health impacts. But the various international lung associations, these are, you know, lung specialists, respiratory physicians globally, are worried about the normalization of vaping and the extent of vaping. And these are doctors who are instinctively, I suppose, hate cigarettes. And you'd imagine if they really believed that you know, nicotine vape products were a solution to the problems caused by smoking cigarettes, they'd be enthusiastic about them, but they're not. They're really sounding the alarm bell. They're saying young people should absolutely not be vaping these products, or indeed any vape products. And I suppose the sad reality for our youth is that they are the guinea pigs in this experiment. You know, human beings have never inhaled vapes in such large quantities and such large numbers down through human history. We've absolutely no idea how this is going to play out. The WHO has also taken a strong position on this and has been quick to call out the behavior of the tobacco industry. The tobacco industry are the key drivers behind vaping and these nicotine pouches, and those industries have a really poor record from a public health perspective, but they have a really long track record in targeting their products at children. Nicotine addiction, whether it's smoking or these vape products, it's a pediatric addiction that persists into adulthood. These businesses are trying to capture young people and hold them there for life. And again, as parents, I think that's a key message maybe to communicate to your sons and daughters, to not be their guinea pigs, to not be their cash cow for the future, who's going to generate ongoing income for them by becoming addicted to the products that they're marketing aggressively and selling. Again, there's also that concern I mentioned, which is that potential progression of some users of nicotine vape products towards vaping these other substances that perhaps are of even more concern to me as a psychiatrist working in the addiction space. We know that there's been diversification, again, in the backdrop of legalization in the States, diversification of the cannabis market. And that's what happens when you legalize things and you get entrepreneurs moving in, trying to figure out how can we sell more of this stuff to more people. So we have edible cannabis products, we have the vape products, and we have the synthetic cannabinoids. The synthetic cannabinoids we actually had in Ireland before. We had them about 15 years ago, back in 2010, when we had the head shops. And these were a core product that were sold by the head shops at that time. And it was certainly when I first became aware of the existence of synthetic cannabinoids. Those products were marketed to be, you know, put into a rollie and smoked. But now the synthetic cannabinoids are sort of getting a second life via vape type products, although they're often marketed and sold to young people as though they're THC. And parents were really powerful, actually, going back 15 years ago in leading the call for society to wake up to the damage that head shops were causing to our youth. And there was really pretty significant protest, and the political system paid attention to that, those expressions of parental and adult concern, and acted really quickly, actually, to shut down our head shops, introducing novel legislation within months. We were pretty much the quickest in Europe, or globally indeed, to respond to the challenge posed by head shops. Again, with the call for action been led by parents. So once again, it's great to see so many parents engaged with this issue today. And going back to the HHC products, so these are the products that were sold legally in our shops. So the pictures you see here are ones I took from products that were sold online. They were marketed as having intoxicating effects. There were reviews online from people talking about their impacts, their ability to induce an intense euphoria and relaxation. So they were actually been marketed as psychoactive drugs. We have legislation in Ireland which actually says it's a criminal offence to sell a psychoactive drugs, but for reasons I've never been able to fully understand, that legislation was not used to nip this market in the bud 2 years ago, and they were allowed to continue to sell HHC products for the guts of 2 years in the end. And psychiatrists and addiction specialists, I suppose, were pointing out the hazards and harms. Mental health professionals were pointing out the role and the link with psychosis from early in 2024 in a number of research papers. And I've already alluded to the fact that HHC has become the second most common cause of drug-induced psychosis in Irish hospitals. So in terms of that journey, across HHC, because even though it might be sort of largely sorted now, it's important to look back and learn, I suppose, from challenges that we face as a society and what might we do better next time. Because the reality is, having been pretty much the quickest in Europe to address the challenge posed by head shops 15 years ago, we were actually pretty much the slowest in Europe to protect our citizens from HHC in this more recent issue. Doctors did begin communicating concerns into the Department of Health in late 2023. That didn't really provoke any significant response, and doctors continued to raise those concerns. And with my College of Psychiatry hat on, certainly I was pretty vocal about this about a year ago. But it actually took the United Nations Office of Drug Control to step in March of this year. They added HHC to the list of narcotic drugs, so put it in the same category as cocaine and so on. And Ireland, as a signatory to the UN Conventions on Narcotic Drugs, is then obliged to make it illegal. So rather than actually responding to the concerns expressed by doctors over a 2-year period, ultimately the department was forced to act by the UN drug conventions. So HHC was finally banned in August. Unfortunately, though, it was banned really without any particular plan being put in place. So obviously the commercial retailers who were selling HHC weren't given any clear guidance as to what they were meant to do with this product, which was now as illegal as cocaine is. And I think what seems to have happened is that that product has been spirited away and is now cropping up and is available for young people to purchase via illicit routes. We hear from some young people that they can actually access it under the counter, and if anyone here is aware of that actually happening in any particular shop, I'd urge you to report it to An Garda Síochána, because that is drug dealing. And I suppose also worryingly, new products seem to have arrived into some of these specialist stores that were previously selling HHC. It's not really clear what they contain. These products are not being actively monitored or scrutinized. And again, that's really worrying that we're just going to end up in a bit of a loop of new products emerging. These shops will take comfort from the fact that they really got away with selling HHC with impunity for a couple of years. Some of them might be scared out of the marketplace, but others will persist with it. And when there's money to be made, you're going to get some people who will have a go at it. With regards to the spice type products, as I've sort of are the products have been sold to young people as THC. Certainly the research from the UK indicates, as I've already said, that these products generally contain the synthetic cannabinoids, which are even nastier than HHC or THC. And it's likely to be the same in Ireland. In terms of the problems that young people can expect with cannabinoids, whether it's a synthetic cannabinoid, HHC, or cannabis, we tend to see problems in the same domain. And the more common problems, so this is data here from these are people young and old indeed, who attended emergency departments across Europe for cannabinoid or cannabis-related reasons. And it shows the type of symptoms or medical or mental health problems that they were presenting to these emergency departments with. And the most common problems that people present with, irrespective of the type of cannabinoid or cannabis, are mental health issues. While cannabis has a reputation of being a chill-out drug, certainly when higher potency products are used, people can develop panic attacks and get very agitated and distressed. Some people develop psychotic type symptoms, hallucinations, becoming paranoid, and so on. Other people, cannabis and cannabinoids tend to push up your heart rate. That can cause people to experience palpitations, and that's compounded by the anxiety-inducing effects of cannabis. People can get very distressed and rush to hospital thinking that they're having a heart attack. Cannabis and cannabinoids as well, the bad news for people who use them heavily or regularly is that they can cause withdrawals. And when you look at the withdrawal symptoms, you see the top of the list is irritability, anger, and aggression. And for parents who are living with a teenager who's a heavy user of cannabis, as many of the young people who attend our addiction services are, this is by far the most common problem that parents will report is just walking on eggshells in their own home with this really angry, irritable teenager who is cycling in and out of cannabis intoxication and withdrawals. Also, where young people who are dependent on cannabis don't have cannabis, they'll notice their degree of anxiety or stress increases, they'll sleep more poorly, and their mood can decline. Again, this is particularly unfortunate when you look at the reasons why young people self-report cannabis use. And again, this is data from a European survey. And again, the most common reasons are mental health reasons. So they're using cannabis, they think, to treat their depression, to address their sleep problems, and to help them relax and to reduce their stress level, without realizing that it is the cannabis itself that is more than likely the explanation for their poor sleep, low mood, and increased stress. It's a bit like, you know, a dependent drinker using alcohol to treat their sweats and their shakes. Obviously, using alcohol for those reasons will work, but you know, it's not that you have a problem with sweats or shakes, you have a problem with being alcohol dependent. And most drinkers will recognize that. But unfortunately, lots of cannabis users, because of all of the pro-cannabis propaganda, which again has gone unchallenged across social and mainstream media, which have been telling young people that cannabis is some sort of a miracle medicine that treats anything and everything, young people really believe it's legitimate to use cannabis to address mental health issues, when the advice from psychiatrists is this is absolutely not the case. If you've got any mental health issues, cannabis is a really bad substance to consume. With regard to HHC, if you look at the right-hand side of this slide, first of all, you see the reasons for HHC use are very much the same as the reasons for nicotine use, the reasons for cocaine use, or MDMA use. It's to get high and curiosity, I suppose. But you also do see mental health motivations quite prominent there, as they are with cannabis. And again, it's partly because HHC producers tried to piggyback on that pro-cannabis, medical cannabis type propaganda, and unfortunately suckered a lot of young people into believing that it has mental health benefits when it certainly doesn't. Because if you look at the left-hand side, at HHC users' self-reported problems linked to HHC use, you'll see anxiety is, I suppose, the most prominent one. If you look on the right-hand side there, you'll see suicidal thoughts are reported by 1 in 10 HHC users. So again, not a good drug to consume if you've got mental health issues. So with regard to understanding the risks of THC vapes, HHC, I think we have to be guided by the evidence that we know already exists for cannabis. And basically every medical authority out there that's looked into this issue takes a pretty dim view on cannabis and its problems with addiction, its problems in terms of inducing or causing mental health problems, with psychosis being at the tip of the iceberg, but also impacts on cognition, on memory, on IQ, which may be a long-term adverse impact, particularly where young people use heavily and during the adolescent years. Finishing up with some of the data from that Irish survey, again, looking at, well, who is more or less likely to use these products, the vape-type products. So what these slides look at is teenager self-reported drunkenness, their cannabis use, and their use of e-cigarettes in the last month, and risk and protective factors. So young people who are more connected to home, to family, to their parents, are less likely to use these products. Young people who whose parents, or who this is young people self-report themselves, that they believe their parents know where they are, are less likely to use any of these products or these health damaging, potentially addictive behaviors. People who are just out and about report sort of hanging out and about in an unstructured, unsupervised way with their friends. Again, people who do that most often are the ones who are most likely to drift down the path of using these substances. People who believe their parents are a bit more chilled out about in this instance, about their drinking and getting drunk. Those young people also are the ones who are more likely to use cannabis, more likely to use e-cigarettes. So I suppose our advice to parents is, don't be chilled out or casual about your 15 or 16-year-old drinking, vaping, or engaging in any substance use. I think we as parents need to have an expectation that our kids not head down this path, for all of the reasons I've mentioned earlier, in terms of the addiction risks, the mental health risks, the brain development risks, and so on. And I suppose the challenge I've put to you, I suppose, is to be more present in your sons and daughters' lives, to take, to figure out who are their friends, where are they spending their time, try and create opportunities that there's more time spent at home or in structured, supervised ways with yourself, or perhaps with other supervised adults via their hobbies, interests, or clubs, and actively supporting all of them. And that's all sort of work, I suppose, for us as parents, and building expectations around what they do and what they not do. Then the nicer side of being a parent is, I suppose, the communicating, the empathy, and connecting with our sons and daughters at an emotional level. And actually, one of the pleasing things about the survey is that it said that most teenagers say they live in that sort of a home and they experience their parents to be loving and caring. But if they didn't experience their parents in that way, they're much more likely certainly to smoke cannabis, to use vape products, and so on. And young people who report poorer mental health are also more likely to be tempted to try to use any of these substances, whether it's drink, cannabis, or vapes, as some sort of a maladaptive coping strategy to provide some maybe short-term relief, but ultimately, unfortunately, longer-term damage in relation to their mental health. So in summary, this is a completely or a largely unregulated space. Do not assume just because something is sold in a shop that it's been evaluated or tested, or that even the shopkeeper themselves actually knows what's in it. We don't live, while we live in a highly regulated world in some ways, there's products like this that are just largely left loose to the Wild West. We're beginning to, as Martina said, put legislation in place, but we're really 5 steps behind. So parents, I guess, beware. Children and adolescents are absolutely been targeted by the nicotine industry with this wide range of child-friendly, child-flavored type products. Be aware of the fact that vape products, even though the packaging might be all bright and glitzy and designed to attract kids, the actual vapes themselves are very anonymous, and they're also vape juice is largely odorless. So you won't have a clue what your son or daughter is vaping if you see a vape in their hand. You won't know if is it HHC or some other cannabinoid type product, or is it nicotine, or is it just flavors. Unfortunately, this whole issue of vaping hasn't been the priority for stakeholders, for government departments, for An Garda Síochána that I think it should have been. An Garda Síochána and government departments have got, they've got lots of other issues that the public is exercised about, and vaping is struggling to compete against all those other issues. And I suppose we'd urge you, if you're concerned about this issue, to be vocal, I suppose, about those concerns. Ultimately, though, while it's a new challenge, I think it's important that you equip yourself with knowledge. Knowledge gives you some power and some influence and some ability to influence, so that's part of the purpose of today. And the truth is, and the good news is, that also the same strategies that we're using to reduce the likelihood of our sons and daughters heading down the path of cigarette smoking or drinking or drug use seem broadly to be the ones that are effective in reducing the risk that kids head down this path of vape use. So don't underestimate your influence as parents. You're probably the biggest single influence, even though you are competing against other influences. So I'll stop there. Thank you.
Thank you so much, Bobby. We have a lot of questions coming in. Very interesting area of the evolving market and new challenges. Last but not least, we have Emer Lockery. So Emer is an accredited psychotherapist and senior counsellor with the HSE's under 18 dual diagnosis team in Yoda. With over 26 years experience supporting vulnerable children and families, she has spent the last 16 years specialising in adolescent substance use. Emer holds qualifications in social care, psychotherapy, child and adolescent psychotherapy, and criminology. Her background spans from residential care, community development, and in national in-reach services. Emer works closely with families and community teams to develop interventions and is known for her empathic, collaborative approach and commitment to best practice. And I have to say, anyone that sees Emer speaking will definitely see the empathy that Emer has for young people. It's great to see. And Emer today will be covering spotting the signs and minimising vaping harms. Thank you, Emer. Emer, I think you're muted there.
Thanks so much, Nikki, and thanks for inviting me to be part of today. I just wanted to double check if somebody got my slides there in the background. No.
One moment, we'll get them up for you.
That's okay. I can get started. Listen, hasn't it been absolutely fantastic to listen to, I suppose, our colleagues' expertise in both the tobacco issues, vaping, and I suppose then moving into cannabis-based products. And I suppose my day-to-day work really involves facing, I suppose, the consequences of that for parents and for children and teenagers every day. So I probably won't apologize for saying that I find the upset that this can cause families quite real. And I suppose it's quite traumatizing actually. And the last couple of months, I suppose in my work, seeing the impact of the HHC has been extremely frightening. I've worked with substance use for a long time, and I've seen damage in a way that I'd never seen before. So I was really, really excited to be part of this today. And I'm really conscious of the parents out there that are listening and kind of starting to, maybe the pennies beginning to drop and they're beginning to recognize, oh, hold on a second. I think my own was, doing something the other night and I wasn't sure what it was. And the fear might be coming over some parents today because, I mean, the facts are I mean, you've been given an awful lot of medical information and data there that's very much strongly evidence-based, and it's very, very clear. Some of these substances cause very significant harm. And we are talking about teenagers. We're talking about young people who are growing and developing and figuring out their tribe and wondering, who am I and where do I fit into society? And I suppose their context now is, I suppose, surrounded by a substance, a new substance that they now need to navigate, and a substance that's kind of been normalized. What I mean by that is I'm actually talking very specifically about the vaping type products. That's everything from nicotine all the way up to the HHC products. And the reality is that the feedback that I get here on a daily basis is that they're interchangeable. And if one young person in a group is using a nicotine vape, the chances are that somebody else is using a different type of vape. As I say, I'm around for a long time, so I'm even struggling myself these days to actually identify which ones are the synthetic substances and which ones are the nicotine. Not that either are any good for the developing and growing mind, but I can totally relate as a parent myself to any parent out there that's trying to figure out and understand, how do I know which is which? So I just want to start with kind of, I suppose, bring us back to basics here today and trying to ground our understanding of teenagers in the reality of where they're at. And that is, they're still apprentice adults. They have the 16, 15, 13 years of life experience behind them to be able to navigate and understand some of these challenges that they're facing. And we need to remember them. We need to remember that. And as part of being an apprentice, you know, a bit like driving the car, you'll support them and help them and teach them as best you can when they're ready. And then you might send them off for some more lessons, and then they go away and they'll be tested, and they'll figure out whether they've learned enough themselves. So I suppose parenting in some respects of teenagers is very much like that analogy, that we kind of want to be a bit of a scaffold and a support for them, yet we also don't want to be so risk averse that we can't let them out to the world, because that's not going to build their I suppose their resilience. Can we pass on to the next slide, please? Or can I do that from, oh, thank you. So I suppose the first place I kind of wanted to start with is kind of reminding people of the importance of, I suppose, the hope that we have for our adolescents is that they become critical thinkers, that they step into a situation themselves and they have an idea and a view, an opinion, and they have some information as well. And I suppose later on in this slide, I mentioned, you know, educate yourself. I'm so proud of any of you that are sitting here today and listening and are eager enough to kind of check in and try and understand this information. I work in this every day and I still need to keep teaching myself, because the world of substances is constantly changing and it's kind of hard to stay on top of it if you're not tuning in. But another really brilliant way of tuning in is through your relationship with your kid. You know, get to know them, spend time with them. Their job in adolescence is to kind of push you away a little bit, because their job is to learn to become independent and self-regulating and being able to rely on themselves for things. So you've now got to do a different kind of movement, which is moving closer to their world. And the best way of doing that is by being curious. Try really hard, and I know how hard this is, to not lecture. You can imagine how what a beautiful life my teenagers have with a mom who works in this area, but you have to stop lecturing and telling them about all the bad things. They are going to switch off and not want to listen to you. So gently open up the conversation. You can use this, you know, webinar today, you can use the radio, the TV, and say that you heard about these things that are happening you know, in the lives of adolescents, and you're curious about what do they think, what do they know. Do these, you know, have those conversations when you're in the car, maybe when you're making dinner. Try not do the sitting down, I want us to have a chat moment, because straight away they're going to switch off. So we want to kind of share information with them, but based on what they already kind of know. So we want to kind of build on the information they already have and encourage them to be curious about, you know, the ups and the downs, the pros and the cons. I suppose as professionals working in this area, if we go straight into what's bad for you and why drugs are bad, which, you know, we're absolutely clear and committed to here in the HSE, substances for under 18s is really going to impact the developing brain. And we want all young people in our society to get to 18, 19 and 20 when the brain is really beginning to develop properly, and where they're, I suppose, their thinking is clearer and more experienced and more informed, that they are going to make whatever decisions they're going to make then. But the hope is to try and help them get through that journey as safe as possible. So again, educating yourself, being curious, inviting conversations in a kind of a relaxed type way, not in a lecturing moment. The next thing is just to remind ourselves, and I suppose as parents, you know, families are really busy, and lots of families are doing their absolute best to get young people to different activities and to get to work as well, and do whatever is required in the family home. But I think one of the most important roles we have, particularly when children in those adolescence years, is that we need to be their strong anchor. We need them to know that we're there for them to talk to be available to bounce even ideas or experiences off us that they might, you know, other kids might not normally tell their parents. We want them to know that we're there and we're open yes, we have our ideas, and yes, we have our hopes and wishes and values for our young people, which really should be integrated in how we live our lives in our family homes. But equally, we need them to know that, based on the fact that they are in their apprenticeship, that we're there for them in the background should they need us. But they will not come to us if we do not have a relationship with them. And I suppose that's where the substance piece comes in. So I know today we're very clearly talking about cannabis, and we're talking about vaping products, which very clearly cause harm to the developing brain. And we've heard a lot about that today. But I suppose for me, I suppose visually, I always have in my mind, substances that become, and I suppose, a regular part of a young adolescent's life. What it serves to do is it brings the relationship between the young person and the parents in two different directions. So our job as parents, and it really is a job, and a job we have to take the most serious during these kind of couple of very, very vulnerable years, for them to be really solid in their understanding that mom or dad or whoever are my guardians are the people that are there for me, and I can bounce things off them when I see something that I'm uncomfortable with, that I don't know how to manage, and that I'm a little bit stuck. And it's okay if they do that, and they for you to go back to them and say, I may not have all the answers, but you know what? Let's just talk about it between the two of us and figure it out together. Because sometimes parents really do forget that actually that's all that young people sometimes want. They just want a bit of a validation that actually, yeah, this is a little bit nerve-wracking and this is a little bit scary, and a bit of kind of hope and reassurance that you're letting your young person know, I'm really glad you're talking to me about it, and I'm really glad, and I'll check in with you about it maybe next week or the week after, whenever you feel comfortable with it. I suppose this piece of joining them in their world, for me, is a really, really important piece. And I use a kind of common example that I hear both in my own extended family and in my world of work. And it's, kind of a lot of parents kind of saying, like, well, he's up there playing on the PlayStation and won't talk to me, or she's up there in the room listening to music and, we never see her. And that's a real normal. So I would say celebrate that. That's normal adolescent behavior to a degree, and they're trying to find a way of separating from you. However, it's your job to get up off the couch and go and visit them in their world. Check in on them, drop in a cup of tea, say, hi, how did the day go? Just wondering, how did that basketball match go? Or how did so-and-so get on with her, I don't know, biology today, or that row you had with teacher yesterday? How did that come around? I think we've got to go to them and not to, don't question that, don't question that. That's totally normal, and that's okay. And them not joining you in your world is appropriately developmental and on track. And as I just said here, just don't wait for them to join you. And listen, if they're joining you, isn't that fantastic? And that's evidence that they're in a place where they want to join you. And again, celebrate it, roll with it. Next slide, please. Okay, so we've touched on this already a little bit, and I'm sure there'll be some really good questions that will come in that we can talk more to it. But it is about building a relationship, and I'm really conscious that we've got parents with children of different ages, so yes, ideally that starts early on in the child's life, and that's how we would want it. But I'm also conscious that we don't live in a perfect world, and people's lives haven't always been haven't always been great for them, that they have been able to do that with their children for whatever reason. But I would always say it's never too late. And I think keeping conversations as open and honest, and sharing maybe your own challenges as an adolescent, and what that was like, because some of the problem solving pieces that you may have been involved in as an adolescent will actually kind of humanize you a little bit more with your own teenagers. Again, being present, I suppose this word parental presence it's commonly used in our area of work, and equally it's used in the whole area of early intervention and prevention. And the more present and available you can be to them, the better chances they have of being able to have a solid adult in the background that they can bounce things off. And that doesn't always have to be parents. Like, I think sometimes parents have a lot of pressure doing lots of things, and that there may actually be an aunt or an uncle or a cousin or a nephew or somebody in the extended family or a very close family friend that you know your young person has a good rapport with. And I would say just encourage those connections, and try and kind of influence that person to remind your young person when they're doing things that are really positive. Small little things. It doesn't have to be a big song and a dance and a big celebration, but keeping connection is essentially really, really important. Boundaries. This is the part of the conversation most people don't like, including myself. But I can only tell you, and listening here in my therapy space for a lot of years, the amount of young people who will come back and say, I'm so glad my mom and dad said I couldn't do that, or I'm so glad they stopped me. I'm so glad they made me do what I didn't want to do back then. And if they didn't, things would have been very different. But sometimes you have to prepare yourself for that row. And that's where parental self-care comes in, and recognizing that you've got a challenging job during these teenage years. So set the boundaries, have expectations. It's okay to have expectations. It doesn't make you, it might make you a slightly unpopular parent, because I suppose we are seeing the challenges that some parents are having now at the moment of, comparing and contrast with other families, and so is allowed to do this, and so is allowed to do this. I think you've got to come back to what your own family boundaries and values are. And they are going to be different for every family. But I suppose, and we're going to move on in a few seconds to looking at kind of the vulnerabilities in our own, our own communities, our own families, past mental health issues in family systems, and past addiction issues in family systems. These all add vulnerabilities to our young people. And there's a majority of that in our society, that these young people need boundaries, they need expectations, because that's what actually keeps them safe. And I suppose somebody touched on earlier on in our presentations about the developing brain. And I suppose reminding ourselves that the frontal part of our young people's brain, it's still only growing and developing. And I suppose, we as their parents are kind of their brakes for a while they're being that apprentice and figuring out who they are, who's their tribe, where do they feel safe, and figuring out how to say no. And we all know saying no is not that easy. And we all know how hard it is to change certain behaviors. And behavioral change is not easy. So if a young person comes to you and tells you that actually, yeah, they've been smoking either weed or engaged in some form of substance use or using HHC, the first thing you don't do is don't get angry. Applaud them, thank them for coming to you. Hold and regulate. Don't allow your head to go into that place of disappointment, anger, distress. You've got to applaud them for coming to you, because that's what you want them to do. They're coming to you, it's fantastic. It's the kids that are not going to their parents I worry about. It's the kids that feel, I can't tell mom and dad what I need to do, what I've been doing. And now I'm stuck and I really need to get out of this and I don't know how to. And then the next piece here is example. Again, how are we modeling for our kids? And that's not just, are we smoking or are we drinking in front of them? How are we celebrating in front of them? So yes, it's all of that, but it's also more. It's the bit of how we showing our kids that we've lost our temper and that was inappropriate. How do we show our kids that actually, I've had a really bad day in work today, but actually, instead of having a glass of wine, I'm actually going to go for a walk and just spend some time by myself and decompress. How are we modeling that it's okay to cope without using a substance to regulate ourselves? I do get really worried about adolescents who are using vape products of any kind to regulate and to fit in and to feel secure and connected at this age, because my worry is that kind of habit has begun at an early stage, and they're going to start convince themselves like I can't do without whatever it is that I'm using. Next slide, please. Okay, so this is a topic I could spend a lot of time talking about, and I just want to touch on it today, because I'm really conscious that we have a lot of young people out in our community who are autistic or neurodiverse in some way. And I'm not going to get into definitions and, the different kind of ways in which people interpret this. Sorry. However, I really want to be really clear. There is strong evidence out there that tells us that young people who are substance using in even an experimental way and who are neurodiverse in some way are more likely to develop issues with substance use behaviors. Sorry, some water. So I suppose if you're a parent of a 10-year-old, 11-year-old, 12-year-old, I would kind of just encourage you to understand your own child's neurodiversity, make sense of kind of, what strengths that brings into their daily life, but also ask yourself, what are the challenges they're having currently? What supports are in place around those challenges? And how might that look when they hit 13 and 14? Because as we know, at 13 and 14, that beautiful protective scaffold that we put around children when they're in their, primary years is not the same when they're in secondary school. And it's no shock or surprise to me why we get kids who've kind of gone through first year and then we hear that actually first year was a nightmare for them, and all the neurodiverse kind of challenges that some of them have experienced or hadn't properly experienced are starting to become a real issue for them. And of course, this is a nice time when experimental use of lots of things happen in adolescents' world. So sometimes it can be the perfect storm. And again, a lot of my own work and my own research has very clearly showed me that a lot of the substance use that occurs during neurodiversity sometimes has a different meaning to that of neurotypical young people. So in other words, a lot of the research that's coming out, and it's still very young, but it's telling us that young people are substance using to manage their symptoms in a way that maybe other neurotypical young people wouldn't do. And because of their already some of their daily challenges, that makes them so much more vulnerable, because naturally it's going to feel nice very, very quickly. So yeah, anybody that's out there that's kind of trying to, think about this in the context of their own children, if there's, traits or concerns around any neurodiverse kind of potential issues, just go and get support around this. Don't wait. Don't hold off till they're 15 and 16. It's a bit more of a challenge to manage then. Next slide, please. So this is just kind of a bit of a summary of what we've kind of been talking about. So just ask and listen. Resist any urge to lecture. Try and explore reasons. So if they have arrived at your doorstep and they're kind of saying, listen, ma'am, this is what I've been doing, this is what's been going on, I shouldn't have done it, I'm really sorry. Try and explore the reasons. And actually, I'm actually even questioning myself for putting that there, because one thing I recognize, some young people don't know the reasons why. They really don't. And they do struggle to put it into words. They will give you a simplified version, which is, my friends were doing it, or I didn't realize that it was what it was, or whatever. They will give you some surface answer. And that might be the best answer they can give you. And again, if they're talking to you, celebrate, regulate, press the pause button. Don't get distressed when they come to you. On the inside, you might be having a nervous breakdown, but you've got to fake it to make it and put on your mask for those moments when they're talking to you, because you want them to keep coming back. Again, be mindful of your own family history. And I think as teenagers start to get older and we're trying to kind of influence, their thinking around substances, I don't believe in giving lots of horror stories, because that can be very frightening as well. And sometimes kids can integrate that into, well, that's definitely going to happen to me. But I think it's just trying to gently teach them a little bit about maybe why you're so maybe animated or worried about them taking a drink or using a HHC vape. And you're right to do so, But again, just do it in a way that I suppose they're going to listen to you. Again, I strongly encourage, it's okay to have your own family values and rules. They need your guidance, and they need, they need you to keep them safe. Persist in your efforts to influence your young person, but resist losing the head with them. So you've got to keep trying. And I know there's lots of people probably listening out there that are kind of saying, well, I've just had enough and I'm giving up. And what I would say to you is go get support. If it's at that level, of course you're going burnt out and tired. You need other people to help you with this. And the services out there and are only dying to help. And we've got some fantastic professionals across the country that can help in this area. So don't be alone, and don't allow the shame keep you quiet. And finally, monitor and affirm adherence to agreed expectations. And I suppose going back to what Bobby was saying, have an idea of where they are. Let them know that you want to know where they are, and that there's an expectation that you have a rough idea of what they're doing, who they're with, and their general whereabouts. Next slide. So if anybody's just interested in looking at the assets list, it's a very simple list, but it can be a really nice kind of guide for you in your own family to kind of have a look and see where am I at in terms of looking at my own child's outcomes. I think that's the last slide. Dimensions of resilience. I'm actually not going to go into that because I suppose I'm just conscious we've got time. We just want to give some time for questions and answers, and it'll probably weave its way into some of the questions. Thanks so much for having me, and I hope somebody gets something out of what we chatted about today.
Thank you so much, Emer, Bobby and Martina. And, we did go a little bit over time. We've less time for questions, but I think it was really worth it. I think there was really excellent information in there for parents. And I think a lot of the questions that are coming in have been answered. But I might start on resilience, seeing as it was on your last slide, Emer. And we are getting quite a lot of questions in relation to how do you build resilience and refusal skills. So we're getting quite a lot of questions from parents on how to support young people navigating this very new landscape, both in terms of vaping and in terms of illicit substance. So we might just pose that question to the three of you in terms of how can we better support young people to refuse and to manage peer pressure for these products?
Yeah, listen, it's a great question. I listen, it's such a common topic at the moment, and I know Bobby has some really good ideas on this as well. I suppose if I'm going to talk plainly, I kind of feel like, quite honestly, we're living in a society where we're wrapping some kids up in cotton wool, and then they're getting to 17 and 18, and we're expecting them to be adults. I think we've got to allow young people to navigate risk in a way that they know where they're in the background. And that's everything. Like, I was talking to somebody recently, and, their child wouldn't go up and order a latte in a coffee shop, and the child was 13 or 14. I'm kind of going, Mother of God, if they can't do that, how are they going to say no in the toilets in school? When someone's offering them some kind of a vape, it's quite difficult, really. So there's building, I suppose, natural skills in the everyday world, and having expectations that they do certain things in the house with their friends. They go places, they make plans, they organize, and they start to do it themselves. That not mommy and daddy are going to do everything for them, because that means then they have to start using their own critical thinking. And my concern is that, rightly, we are coming across a lot of young people are finding themselves in those situations, and they're blinded and they don't know how to deal with it. And very, very quickly, just a couple of small tips that a lot of our young people would even share here with us. Distraction techniques, having something else in their hand, having a pen, having something else in their hand that they're fidgeting with. Sometimes vapes can be a really good fidget tool. So you'd rather they didn't have a vape in their hand. Chewing a gum, eating a lollipop, be doing something else while everybody else is doing what they're doing, but you're doing your own thing and you're still part of the peer group. Finding a way of being yourself, I think, is part of that identity development that takes time and support. But I'm going to hand you over to Bobby, because I know he's got some really good examples on that.
I think you've covered loads of it there, Emer, but one of the pieces is, I guess, trying to intervene earlier. I'm conscious that we've got parents across the age span here. Hopefully there's some parents of younger teenagers or even older primary school age. And it's about, as Emer sort of alluded to earlier, being curious with your kids about what's happening in the world. They are seeing vapes and people vaping, and it's an opportunity just to open up the conversation. And what do you make of that? Or what do they think about it? And usually younger kids will be very disapproving, and they'll have a big long list of reasons about why this isn't so good. But you try to help them develop that list of reasons why this is maybe not a smart path to go down, affirming them for not doing so. And that process of helping them talk through these issues themselves will put them in a stronger position if they are then presented with the opportunity to use it. They already have the narrative in their head, but the reasons why, no, that's not for me. You know, good luck to you with your vaping, but I think I'll pass. And that's ultimately all you want them to do. And to continue revisiting those sorts of conversations. And if they do describe situations whereby, so-and-so was doing X or Y and they chose not to, again, to be curious about why they chose not to. And again, using that experience and their own words, I suppose, to consolidate the choices that you're keen to see happening.
Great. I might just hop on specifically to nicotine vaping, Martina. So we have quite a lot of questions in from parents on how do you help young people understand the risks, but also some resilience. So just a quick question for you specifically, are e-cigarettes useful in smoking cessation? And second to that, have we seen a reduction in smoking in Ireland because people are now vaping?
Yeah, so when we published the clinical guidelines in 2022, prior to that, the Department of Health commissioned the Health Research Board to examine the evidence in terms of e-cigarettes so that we could be clear on what our position on e-cigarettes is and whether or not we would recommend it as a stop smoking aid. And they found that e-cigarettes were no more helpful than licensed stop smoking medication. There was a question in there as well. So it's kind of a challenging one because for some individuals, e-cigarettes have helped them. And I personally know people who have quit using an e-cigarette. But at a population level, it hasn't actually helped. And in fact, we've done a study where we've looked at the data for the last 8 to 10 years. And we have found that dual use is now more common. Quitting intentionality is now waned. So historically, people who took up e-cigarettes were doing so with the intention of quitting, but now they're actually doing both. So they're smoking and they're vaping. So they have the inside fag and the outside fag, and actually taking on more nicotine and are more heavily addicted. And that's really challenging for them in terms of cessation. So that's what we've found. We've had a kind of a social experiment, I suppose, for want of a better word, for the last 10 years, where we've had access to e-cigarettes, kind of as a consumer product, and it hasn't really reduced smoking prevalence. Our smoking prevalence is stalled. There was another question just I might address before we move on, is just around why do we recommend nicotine replacement therapy if nicotine in and of itself can cause harm? Nicotine replacement therapy is a licensed medication designed to not stimulate those, dopamine release and the feel-good chemicals, but just to be in a lower dose to just remove withdrawals and alleviate the negative withdrawal symptoms. So it's designed in a different way, and it's designed to be used for only 12 weeks in a reducing dose over that 3-month period. So it's not designed to stimulate and re-stimulate that reward pathway. So that's why there's a difference between licensed nicotine replacement therapy and nicotine that's in an e-cigarette or a pouch. The method of delivery, and it's more concentrated in unlicensed products. So just to explain that.
Great, and that's really helpful for parents to know, because I suppose they do have young people versed in debates and discussions and come back in terms of debating the risks and harms. And I've 2 questions left just before we go. We've 2 minutes left. Just Bobby and Emer, there are some questions in about HHC and THC in general supports. I don't know if you want to address anything on that, but we will be directing, I suppose, to the services directory where people can find local supports. But I'll just put that to you before we finish with one final question.
Yeah, there is now a network of adolescent addiction services around the country. So if a young person is running into problems with the THC, HHC type products, it's about finding out where the service is local to yourself. That a link is going to be provided to that. There's also a drug and alcohol helpline, which is available Monday to Friday, 9 to 5, number of which is 1-800-459-459, where you might get some advice on what you can do while awaiting an appointment, but also get some direction as to where exactly the local service is to you and what the referral criteria are and so on.
I might just add to that, Bobby, and just remind people that Parent Line is still there. They do have an excellent service. And I would also encourage parents to recognise, depending on the service, I would be seeking support for yourself as a parent. So the model of different services around the country might, vary in some way. But I would really urge the parent to have some supports for themselves, because really this is a family issue, and particularly the mental health, I suppose, ramifications that I witnessed myself. It's quite hard for parents to manage that, and they absolutely need to get supports around it. Yeah, and Bobby's mentioned all the contacts, so just don't be afraid. And the people at the end of the drugs line are brilliant. And they'll even give you a bit of guidance even that moment. So yeah, don't be afraid to pick up the phone.
That's an excellent takeaway message for parents to also mind themselves. It is a very difficult thing to navigate. Finally, there are some questions in terms of what's next, legislation, and what role we have in shaping that. And I suppose I'll leave it open to the three of you if you have any final comments, and how can we be better prepared and better respond.
Well, I suppose the health service, our role is to kind of deliver service and respond to healthcare needs of the population. We don't have a direct role in legislation in terms of the development of legislation, although we do have good relationships with the Department of Education or the Department of Health, who do have a role in tobacco and e-cigarette legislation and drug legislation. So we advocate for strengthening legislation and improved legislation in this space, but we really don't have a role in the development of legislation. That is the responsibility of our elected representatives, and we know that there is moves in terms of improving that in terms of the e-cigarette space, which is really welcome.
Legislation, is one of our frustrations, I suppose, working on the front line, is that the world doesn't dance to our tune, I suppose, and we're dealing with the downstream consequences of decisions made elsewhere. And those decisions primarily, as I've alluded to, are entrepreneurs and people trying to make money, and the legislators, in fairness to them, are constantly just having to play catch up. So yeah, we do have a role in advocating for action. I know the Minister for Health, when she announced the ban on HHC there last month, talked about the need to have a review in place to try and ensure that we do manage the next similar challenge in a more proactive way. I look forward to seeing that happen. And Martina's talked about, I suppose, the steps that have been put in place regarding nicotine vapes, but we now have nicotine pouches. We're going to have to really remain active and vigilant, and I hope that it gets properly resourced, because the teams who are drafting this legislation, it's a really, really complicated task. They need, to be fully resourced in their efforts to put the rules in place to protect society.
Thank you so much. So yeah, I think to conclude today, we have seen that young people are now navigating a very different landscape with new products, and they will continue to emerge. And I think just the takeaway message for parents is, please do stay up to date through the HSE's websites. Empower yourself, take a look at our parents' guide on how to have that discussion. Remember that you have a really important role in delaying or preventing that use. And if you do need support, there are services in each community. We will be sharing the link through the post-event email. So please don't be afraid to reach out, call the helpline and get support. Thank you so much.
Thank you.
you.